Hello everyone, today we are going to talk about infertility. Procreation is one of the nature needs of human beings, and infertility is one of the important factors associated with the quality of life for married couples. Married couples may experience emotional problems because of pregnancy failure and may face the risk of social dysfunction, anxiety, and depression. Many causes of female infertility are menstrual abnormalities, endometriosis, pelvic adhesion, ovulatory disorder, tubal blockage, hyperprolactinemia, and uterine abnormalities. Recent research suggests that traditional Oriental medicine is associated with higher likelihood of successful pregnancy in infertile women, which is worthy of further investigation. In this video, we will talk about infertility, its causes, and treatment, in addition to the role of Oriental medicine in treatment. Our role today is to answer most of your questions regarding infertility. Today, we have Dr. Raymond, who is a leading doctor at Jaseng Hospital of Korean medicine. He is going to discuss with us everything about infertility from an experienced medical point of view. Hi, Ume. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. So, Dr. Royer, what is infertility and what causes it?
Okay, when we're talking about infertility, the medical term when you call it infertility is if there is at least 1 year of non-protected sexual. It's not something that, for instance, you get married and you want the children and after 2 or 3 months you're not pregnant yet. That's for us not infertility. It takes time anyways. And even though women, for instance, have their periods every month, it doesn't mean that every month they are fertile. We more or less already know that the real fertility for women is not every month, it's more like 3 or 4 months, every 3 or 4 months. So that means when we are talking about infertility, at least 1 year with no protection and still not pregnant. Then we are looking closer into the issue and then we see what is the problem.
If a couple have been trying for less than a year, it's not considered as...
It's not considered officially as infertility.
It doesn't matter if it's a woman or a man.
Yes.
It's for both. So infertility, it's more common in female or in male?
Usually the society tends to put all the pressure on the women's side. However, the scientific proof tells us it's about half-half. It's not 50-50, we say about 30% women, 30% men, and then maybe 20% a mixture of both.
Okay. And
then there's still about 15-20% where we say, we don't know. We don't know why it happens. There's everything, all the tests are normal, everything looks good, but still we don't know why it doesn't.
So there are some cases where the female and male are both very healthy and fertile, but they're just not a match for each other.
They're not a match. Somehow not a match.
Somehow. Naturally.
But there's no real official explanation why. Unknown cause.
So what are the most common causes of infertility for both the cases of men and women?
I would say for men, of course, it's again stress. We know the more stress there is, it seems to have an influence also on the production of semen somehow. So stress is a factor. Then smoking. Smoking, we know it's also a big factor. And then there is also some exercises actually are seen as being also contra-effective for producing the semen. One is cycling, because when the men sit on the saddle for a long time, it compresses the prostate somehow, and that also seems to have negative impact on infertility. So, and of course then alcohol could be also a factor that influences. Basically the question is how much and how good quality of semen can be produced, and everything what influences the production process, or the erection process, which is a stress factor mostly, or some diseases like diabetes and obesity for men especially, also has a big impact on the infertility of men.
How about women?
For women, there could be different issues. First of all, if their tube is kind of closed, so the eggs cannot really move properly from the ovaries down. So that happens often, that there are some functional problems in the ovaries. Polycystic ovaries, for instance, that is also a cause. Then endometriosis. So there is some tissue which grow somewhere between, useless tissue, and that influences the function of the sexual organs, the uterus and those tubes as well. So I would say those are the main issues for infertility.
So is it safe to say that there are no symptoms to infertility?
Symptoms, yes. I mean, you don't have symptoms in that sense, but maybe for men, of course, if they have erection problems, that's a symptom. That's already a symptom they can feel. Otherwise, most of them, they don't know or recognize anything on their, actually on their body. Yeah, it's just there is no result. For women, the symptoms could be related to the period, menstrual pain. Yeah, for instance, if they have a lot of menstrual pain, there could be some sign there's something going on, like endometriosis or small, whatever, nodules, tumors growing there. Yeah, which could also have an impact on how the function of the uterus and ovaries works. So the symptoms could be also irregular periods. So for women, actually, in most cases, it's more easy to get the clue just from how they feel or what it does, because usually they should have a regular period every month. And if that doesn't happen, or if the period is very painful, or if the bleedings are too heavy, or if there are no bleedings or almost no bleedings. So those are signs that could indicate that there is a problem. Of course, then we have to find out what is the problem. Is it a hormonal problem? So is it just a local problem? Is it a general problem? So then we go into it. But if the period overall is normal, then also we don't see mostly any symptoms.
So how painful is too painful? It's painful for everyone, for menstrual cycle, for example. But at what stage you can say this is not normally painful? This is too painful.
Yeah, I mean, some women start with the pain even a few days before period. They have severe pains. If the pain is so severe that they really cannot really function properly, so that I would say, and especially if it's one day, okay. Yeah, but if it's 5-6 days throughout the whole period that they have severe pain and they rely on painkillers, so then I would say they should get tested and see if there must be something else going on.
So talking about tests, how is it usually diagnosed?
So usually for men, they will checking the semen, the quality, the quantity, the motility, the cells of the semen. So for men, it's like checking the semen, and of course, just asking if the erection and everything is okay. For women, they will do some sonography in order to see if there is something inside visible, changes in the uterus lining. The lining is too thick, too thin. There is some growthing inside, endometriosis. So you have a look into it. And then additionally, you also have to check the hormone levels. Different kind of hormones, are they in a normal range? So then usually you get the pictures, what's going on. Is there any organic functional problem that we can catch, or everything is normal on the male side, and women's side, the periods are, for women, the periods are regular, no issue there. Also the tests are all normal. Then it becomes difficult.
Then it's hard to diagnose or hard to find the causes.
But sometimes there are also issues that the immune system itself kind of attacks the sperm. So the female immune system, when the sperm gets into the body, it starts to attack it. So it kind of destroys the sperm when it comes into the body. It's seen as a foreign, like same as a virus or bacteria. And the immune system kind of strongly responds to this foreign body, the semen, and then it really destroys it. So that is also one cause of infertility, which is seen actually as not too small. So but sometimes it's very difficult to diagnose it. So we know that it's existing, that over-response of the immune system of the female, but it's difficult to really diagnose it as such.
So in this case, what is the solution? Do you give the medication to weaken the immune system, or?
From our side, from the traditional side, of course, we also look into all the tests they have done. Usually they do all the tests, and then they come and say, I tried everything, I tried even IVF, and it didn't work. So then we look into every test is fine, then we check the condition. Sometimes for unexplained, like say unexplained infertility for women, what I have seen is that their lower abdomen feels very cold. So that's very easy to find out. You just put your hand here and check the temperature on the area. Or you do an infrared imaging picture from the whole body. Then you see, for instance, the lower abdomen is blue or black color, which means cold. Red color means warm. So it's very interesting sometimes to see these pictures. Here it's very hot, and here it's very blue, black, cold. If that is the case, even though all the tests, hormonal tests, everything is normal, but for us it's a huge clue to say, okay, this is a dysfunction, it's a low function because of cold. If there is too much cold in this area, of course, cold means that there's less blood supply. If there's less blood supply, of course, the function of the organs also is kind of reduced. And then it's difficult, first of all, to become pregnant, and second, to sustain pregnancy, because usually they lose it. And in many cases of IVF, when it fails, that could be the reason. Everything else is normal, the procedure perfect, and then after 2 weeks, it's gone.
Because the blood supply is not
exactly,
there.
because the function of the organ, because it's too cold. So it's a kind of underfunction, a lower function of the whole area, and it cannot sustain the pregnancy, cannot give the blood supply properly, cannot make the connection properly. So at the end, you lose it. So those are some issues where our medicine can help a lot. So basically, when it's too cold, we have to warm it up. And there are a lot of herbal medications, herbal remedies for infertility. I can say they work very well.
They keep the area warm.
And then it's again prescribed according to the condition. And if we see there's a cold syndrome, as we call it, then we use herbs that kind of heat up the system from the inside, make it warm, help the blood supply then. Only by regulating those issues, it's become easy, or much more easy to become pregnant and sustain pregnancy. So that is one way. Or we apply acupuncture. Acupuncture also helps. It's also internationally scientific proved that acupuncture helps for infertility. And additionally, we also use herbal extracts as injections. So that could be different kind of herbs regarding the problem. And that also can help. So we do some small injection in the abdomen, for instance. That also helps. And then if there's a cold syndrome, we could do moxibustion. Moxibustion is, in the old times, they used dried herbs, make it like a cone, and they burn it on your body. Maybe you have seen that. But nowadays, nobody wants to get burned on the skin. So the modern forms are with protection. There's a small plate on the bottom so that the skin is not burned. It's just the heat goes into the area. So that might also help to warm up the area. So, and of course there can be other issues which also leads to infertility, like stress or overwork, fatigue. And we can also address those problems as we diagnose with herbal medications.
All right. So apart from herbal medications, any other treatments done from your part?
As I said, besides of the herbal medicine is acupuncture. Acupuncture, and sometimes herbal injections. Yeah?
Oh, okay.
Herbal injections that might also include herbs for releasing blockages. If we feel it's kind of blocked, the circulation doesn't work properly, so we apply herbal injection that opens blockages, releases blockages. Or if the area is weak, then we apply herbal extract that kind of builds up, strengthens the area. And then moxibustion, the burning, the heating,
which is not very often used right now.
Yeah, it's also used, but in a more in a safer way. Let's call it safer way. Yeah.
So last question regarding infertility: does age impact infertility in both women and men?
Especially for women, yes, and that's also a big issue nowadays, because in modern societies, usually women, men as well, but women marry later, so they want to have children later in their life. And we know when the age goes over 30, 35, it's becoming much more difficult, because for women, the eggs they have are limited, and the eggs they have, they are produced as a baby, or as when they start to grow. So they become old. And of course, as they become old, the chance that there are some defects in the eggs, that the quality is going low, and also the hormonal changes in the body slowly start. So aging is actually a huge factor, especially for women. So the younger they are, the higher the chance, just regarding age, the higher the chance that they can have children.
So men don't really suffer from this problem?
Not in that extent. Of course, for men with age and heavy workload and a lot of smoking over a long period of time and all these kind of habits piled up with obesity, and then of course, with the age, of course, those issues can also influence the quality of the sperm, and at the end can be also a cause of infertility for men as well, as they get older.
So today we learned many things about infertility, and the doctor explained in details everything related to it, including its management using Oriental medicine. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.